We are in the business of change. Our product is healthcare. Our business is change. Talk about transparency, and this to me has been one of the most fascinating things that's happened in medicine over the last 15, 20 years or so. Really is the way to do business. Because of all this transparency, we have had huge gains in clinical outcomes and patient experience. My challenge to the healthcare field is, why should consumers of healthcare look at this data any differently than you and I did to buy our cameras, computers, and everything? You have a choice between two hospitals. One's a 4-star and a 2-star. Which one you want to go to? The data is significant, whether it's significant or not. And Judy Hibbard said, that which is measured tends to improve. That which is measured publicly tends to improve faster. To me, and I've been quoted on this a bunch of the times, I say transparency is the best thing that's happened to quality since antibiotics. But bottom line, the good of transparency, we've seen tremendous gains. Now, it's come at a cost. What is the bad? It's been a gigantic resource drain. All the stuff you're making us collect, man, costs money. And you don't give us money for that. Medicare doesn't give us money. You know, the average 300-bed hospital now, to give you a perspective, has to have between 12 and 15 FTEs just to collect the data and organize it and abstract it and all the stuff that we got to do. 10 to 12 FTEs that are not compensated. On top of that, the IT costs, so all the platforms and all the rest are gigantic. And then, when you're already at like 99.5%, how much of a quality benefit is there by going to 100? Everybody says, boy, quality transparency is great, satisfaction is great, now let's talk price transparency. That's not so fun to talk about, and we're all fighting our battles with that one. You, though, in the health plan, have a special ability to help us, because you know what it's going to cost the patient to do something. We as docs don't. I mean, if a patient asks me, I say, you need a colonoscopy, how much is it going to cost? I don't know. Depends what plan you got, what deductible you got, where your copay is. I don't have a clue. And by the way, I'm too busy to figure that stuff out. You all know. So I want to challenge us. Where we need help from you is the ability to do this. The public is going to do it. One of the things we know about high deductibles is it is decreasing healthcare costs. Not because we're so darn smart, but all of a sudden the customer has to pay for it. And how do we move that and move it ahead? We're going to get to the point where our databases can be predictive and even prescriptive. What do we do next? Challenge your speakers tomorrow. Challenge your groups. Because we really need to look at how we change in healthcare. We are in the business of change. Our product is healthcare.